Good morning. This is Dr. Sreeja, professor from Chettinad Dental College. So I'm here to present on Scarlet Fever. So you all know this famous novel, right? Scarlet Pimpernel. So here this scarlet indicates the red flower. So here too you have red rashes. That's why the name Scarlet Fever. The child with scarlet fever usually have rashes on the cheek and on the entire skin, like on the hand, leg, everywhere. So this red lesion is because of the erythrogenic toxin, okay, that is released by the beta hemolytic streptococci, which is the cause of the disease. So scarlet fever or scarlatina is an infectious disease which most commonly affects children. The cause is beta hemolytic streptococci, which release erythrogenic toxin. This erythrogenic toxin affects the blood vessels and causes damage to the blood vessels, and thereby you have these red lesions. The pathogenesis is usually the lesion spreads through inhalation from an infected child. So the clinical features are commonly occurs in age group of 3 to 12 years, and the symptoms are usually sore throat, fever, and the characteristic rashes. So the rash is very characteristic for this disease, and usually the rash starts about 12 to 72 hours after the fever had started. And usually you see fine, red, rough textured rashes. And one important feature is the previous picture you saw the child was having those kinds of erythema on the cheek, right? If you apply a glass slide on the erythematous area, on the red area, it blanches upon pressure. So on pressure, it blanches. And also the lesions are more commonly present on the cheek, and they're not present on the circumoral region, that is around the mouth. You don't see these lesions. And the kinds of pimple-like areas that are seen, erythematous areas, are described as sunburn on those pimples. And also the child will have erythematous lines that run through the skin folds, uh, like in the armpits and the groin region. So these lines are called as the Pastias line. Once the rash phase is completed, after the rash phase, after 4 days, the child will enter into the desquamative phase. The desquamative phase is where the skin starts to peel off. Okay, the peeling of the skin is present on the palm, on finger, and on the cheek and face, everywhere. There is peeling of the skin. This phase is called as the desquamative phase. Desquamation means peeling off of the lining area, either the mouth or the skin. So there is a lining mucosa which is getting peeled off. So here it is the skin that is getting peeled off. So it's called desquamative phase. And here you can see the typical picture of the child with rashes on the cheek and also the perioral region which is devoid of the rash. Here you can see the skin folds which is having these kinds of erythematous lines. These are called as a Pastias line. The oral manifestations when you take, the child usually has coated tongue. There is a white coating on the tongue. This, and also you have the blebs of inflamed fungiform papilla seen along the coated tongue. So you have a white area with red dots on top of it. So this is described as a white strawberry tongue. So after the 4th to 5th day of these white coated tongue occurred, there is a phase of desquamation where this entire white coating is lost, and a child will have a bald tongue with only these papillas on top of it. This is described as a red strawberry tongue or the raspberry tongue because it just looks like a raspberry or a strawberry. So this is described as a the red strawberry tongue. Other than this, you will also have punctiform redness on the palate, and the child will have halitosis during the phase of the fever. How do you diagnose this disease? So you have to take a swab and do a gram staining. So when you under gram staining under the microscope, you will be able to appreciate these cocci in chains. So you'll be able to see cocci in chain. These are gram-positive cocci in chains. And also you can go for culturing the swab. So when you go for culture, you go for incubation of 36 degrees Celsius for 18 hours, and we will be able to appreciate beta hemolytic colonies. Beta hemolytic colonies means you have the colonies surrounded by clear zones. The treatment of choice for these diseases, penicillin. The penicillin is the treatment of choice, so you can give amoxicillin for a 10 days course. And if the child is allergic to penicillin, they can be given erythromycin can be administered. For fever, you can give any kind of ibuprofen kind of drugs, and also you can give analgesics if there is any body ache. So usually if you start these kinds of antibiotic treatment in the earlier phase, the chances of spreading to the fellow beings is less. So, and the child responds very well to the treatment. So this is about scarlet fever. Thank you.